Good afternoon, everyone. I'm Valeria Chambers. I'm a certified peer specialist and community researcher with the Center of Excellence for Psychosocial and Systemic Research at Mass General Hospital. I'm joined today with my colleagues, Jacqueline Martinez and Ann Whitman. Jackie, would you tell us a little bit about the research study?
Of course, Valeria, thank you. So we did an online national survey of 173 individuals, 109 peer specialists, and 64 non-peer specialists to look at how peer specialists and non-peer specialists experience and cope with COVID in 2021. In this study, peer specialists included mental health peer support specialists and addiction recovery coaches.
Thank you, Jackie. The article suggests that those trained as peer specialists reported fewer negative outcomes during the pandemic, including less disruption in employment, less loneliness, and less worsening of mental health, while reporting more positive attitudes in the face of difficulties. Peer specialists were also more likely to report more access to and satisfaction with mental health services. And what is your thought about these findings based on your experience as a peer specialist working with other peer specialists?
Well, I want to talk first about the loneliness aspect of this research study. When I and my colleagues went through the peer specialist training, we developed a cohort of peer specialists that turned out to be supportive. They turned out to be our friends and provided a peer network that we accessed over the years. Now, when the pandemic occurred, I got together with the peer specialists that I work with and the peer specialists from the peer specialist training. And we met on a daily basis. We met through Zoom. We talked about the stress of the pandemic. We talked about resources for the pandemic and our feelings of isolation. And so this group was particularly supportive in alleviating loneliness. I think it's also important that CPSs had pretty stable employment during the pandemic. And this is interesting because when we look at loneliness in the two groups, we find that the reporting remains significant even when controlling for employment. And in layman's terms, this means that there's something very special about the peer specialist training that protects against loneliness aside from employment. I think it's also very interesting that the peer specialists developed very positive attitudes during the pandemic. And this is probably because they were involved in mutual peer support, which is very sustaining, helpful, and productive.
Thank you, Anne. The study also found that although people who were not peer specialists were more likely than peer specialists to report having received mental health services during the pandemic, peer specialists reported having more positive experiences receiving mental health services. Jackie, this was an interesting finding. How do you make sense of it?
It certainly was, Valeria. Since peer specialists work within the healthcare system, they may be better able to navigate it, having a greater awareness of available services and resources, and being more skillful in getting treatment needs met. These differences also reflect the benefits of peer specialist training in teaching skills for self-advocacy and getting mental health care needs met. Peer specialist training has also been associated with both a greater sense of empowerment and an increased understanding of the impact of self-care behaviors on one's mental health. In fact, in our overall health.
That makes sense. Thank you. Our final question, Anne, what are your thoughts about the finding that peer specialists had more stable employment than non-peer specialists during the pandemic, and how this affected mental health?
Well, thank you, Valeria. The study found that stable employment was very important in lessening conflict in the home and having better mental health symptoms. This is certainly true for me and my colleagues. We were able to be out of the house more often, and we're in less conflict, I think, with our housemates because we didn't see them 24/7. I also think being employed, we didn't experience as much of the economic hardship of the pandemic as people who lost their jobs or were not employed. So this made for better mental health symptoms and less conflict. I think the stable employment of peer support specialists during the pandemic really speaks volumes to the importance of peer support specialists in our recovery communities and mental health systems. And I would think this would give us evidence to advocate for more peer specialist training, for growing the peer specialist workforce, and perhaps providing some skills training in recovery communities or the mental health system to people that are non-peers.
That would be wonderful. I'd like to thank you both for taking time to speak with me today, and let the audience know that if you would like to learn more information about peer specialist trainings, you can find it at kivacenters.org, or you can go to mass.gov for more information about the recovery learning communities, where there are many different trainings and activities for health and wellness. Thank you.